this circumstance, it's not surprising that there are reports already of South Africans who have perished, who have died, whose deaths can be attributed directly to the strike. And we will be following up on this. But there are already indications just here in Gauteng of specific hospitals where patients have died. There are also reports of other serious, violence and violations of staff, which I will not go into until we get further details. But in one of the hospitals, there is very harrowing reports of serious violation of staff members, which we are waiting to get more details of and make sure that these are all reported to the police. So in terms of thus far, we have been working with all the provinces throughout yesterday and today, working on strategies to try and make sure that we can save as many lives as possible. Many of the provinces, as a result, have obtained court orders which prohibit any NEHAWU member or anybody associated with NEHAWU from obstructing or putting any barricades or stopping anybody from going to provide services at our health facilities. There's a court order which was obtained late today, very specific here in Gauteng, but in 4 other provinces, in the Eastern Cape, in the Free State, in the Northern Cape, and KwaZulu-Natal also. There are sort of maybe similar court orders which have been obtained. So we are indeed very much concerned, and as we know, Gauteng is one of the most hard-hit provinces. The strike, as we know, it's a national one. The severity of the impact on provinces is differ. But as we are here in Gauteng, but we also have reports. Our team at National have been also communicating with colleagues in all the 9 provinces. We will not go into a lot of details, except just to say that just on the high level, Gauteng has been quite more hard hit for various reasons. And then the province of Eastern Cape, also Free State. I'm sure some of you would be aware of some of the incidents, and also KwaZulu-Natal, also some parts of Northwest, especially in the Klerksdorp, Potchefstroom area. Some other parts of the country, minor incidences here and there, but these are the provinces which have been mostly affected. So we've noted with serious concern the approach, a very clear approach of NEHAWU. This is supposed to be a public service strike against, wage disagreements with the state in terms of wages. But what is disappointing and deeply concerning is the deliberate targeting of health facilities. And not just any health facilities, deliberate targeting also of facilities which provide critical care to very severely ill patients, like here at Charlotte and other hospitals. And what is of serious concern to us is the fact that these are the hospitals where, your ordinary South Africans who are not on any private medical insurance depend for their lives when they are seriously ill. That's where they get their specialist services. So for the union, which is supposed to be fighting for the rights of workers, to be specifically targeting hospitals which service ordinary South Africans who don't have anywhere else to go, is indeed quite concerning. Not only in terms of that targeting, but also with a lot of violence and intimidation, people being dragged from the wards, from their work areas, people being physically stopped from entering and denying, ordinary, very, very vulnerable people